Hey there, everyone. Let's talk about something we all love, fruit. It's sweet, refreshing, and packed with vitamins. But did you know that some fruits might be doing more harm than good, especially for us seniors? Yep, you heard that right. While fruit is often touted as healthy, some fruits can actually pose serious risks to your health as you age. So, today, we're going to take a deep dive into the 7 dangerous fruits seniors should never eat. These fruits might surprise you, and so might the risks that come with them. Stick around till the end because you won't want to miss out on these crucial health tips. 1. Grapefruit. Hey there, everyone. Let's start with a fruit that many of us enjoy at breakfast or as a refreshing snack during the day, grapefruit. This fruit has a unique balance of sweet and tart, making it a favorite in many households. But did you know that grapefruit can actually be dangerous for seniors, especially those who are on certain medications? Grapefruit contains compounds known as furanocoumarins. These compounds can interfere with enzymes in the liver that are responsible for breaking down certain medications. If you take medications like blood pressure pills, statins, or even some anti-anxiety medications, these compounds can make those medications more potent than intended, which can lead to harmful side effects. In some cases, this can even cause an overdose, which, of course, is very serious. The issue is that grapefruit affects the way your body metabolizes drugs. It doesn't matter if it's fresh grapefruit or even grapefruit juice, the effects are the same. So, if you are on medication, especially long-term prescriptions, it's best to steer clear of grapefruit or consult your doctor first. The good news is that there are plenty of other citrus fruits, like oranges or tangerines, that can offer a similar refreshing taste without the dangerous side effects. It's always wise to read up on the foods that can interact with your medications, and grapefruit is one of those sneaky culprits you definitely don't want to overlook. If you're ever unsure about what fruits or foods might be a concern, a quick chat with your healthcare provider can go a long way in making sure you're making the best choices for your health. 2. Bananas. Let's talk about bananas. They are one of the most commonly consumed fruits in the world, and for good reason. Bananas are rich in potassium, which helps regulate blood pressure and supports muscle function. They are also a great source of fiber, vitamins, and antioxidants. Many seniors enjoy bananas because they are easy to peel, portable, and provide a quick burst of energy. However, there is a downside to bananas that seniors need to be aware of, especially if they have certain health conditions. The main concern with bananas is their high potassium content. While potassium is important for the body, too much of it can be dangerous, particularly for seniors with kidney issues. Our kidneys play a key role in regulating potassium levels in the body. When we age, our kidneys may not work as efficiently as they used to, which can lead to a buildup of potassium in the bloodstream. This condition is known as hyperkalemia, and it can cause dangerous side effects like irregular heart rhythms, muscle weakness, or even a heart attack in severe cases. For seniors with kidney disease or those at risk of kidney problems, consuming too much potassium can be a serious health threat. Bananas, being one of the highest potassium fruits, can contribute to this issue if eaten in large quantities. If you have kidney problems, it's best to limit your intake of bananas or avoid them altogether. But don't worry, there are plenty of other fruits and foods that can provide potassium without the risk. For example, sweet potatoes, spinach, and avocados are all great sources of potassium that may be easier on your kidneys. If you're unsure about how much potassium you should be consuming, it's always a good idea to speak with your healthcare provider. They can help you understand your specific health needs and recommend safer alternatives for getting the nutrients you need. 3. Pineapple. Next up on our list is pineapple. Pineapple is often seen as a tropical treat that's both refreshing and delicious. With its vibrant color and sweet, tangy flavor, it's easy to see why so many people love it. But for seniors, pineapple can actually cause some unexpected issues, especially when it comes to digestion. Pineapple contains an enzyme called bromelain, which helps break down proteins. This enzyme is great in theory because it aids in digestion, but it can also cause problems for some people, particularly seniors with sensitive stomachs or acid reflux. Bromelain can irritate the stomach lining, leading to heartburn or indigestion. For seniors who already have a weak digestive system or suffer from conditions like acid reflux, consuming pineapple can worsen these symptoms. It can lead to discomfort, bloating, or even more severe issues, especially if eaten in large amounts. Additionally, the acidity of pineapple can make the stomach feel uneasy and trigger gastric distress. So, if you already struggle with heartburn or stomach ulcers, pineapple might not be the best fruit choice for you. If you love pineapple but find that it bothers your stomach, there are some great alternatives you can try. For example, melons like cantaloupe or watermelon are much gentler on the stomach while still providing a refreshing and hydrating snack. Apples and pears are also great choices that are gentle on the digestive system. If you don't want to give up pineapple entirely, consider consuming it in moderation and pairing it with other foods to balance out its acidity. As always, if you're unsure whether pineapple is right for you, it's a good idea to consult with your doctor to make sure it's safe for your specific digestive health. Mangoes. Now, let's talk about mangoes. Mangoes are one of those fruits that just scream summer with their juicy, tropical sweetness. They're full of vitamins, antioxidants, and fiber, making them seem like the perfect healthy snack. But for seniors, especially those who have diabetes or are at risk for blood sugar problems, mangoes can actually be a bit too sweet for comfort. While they're naturally high in sugar, they also contain a type of sugar called fructose. This can cause your blood sugar levels to spike, which is a concern for anyone who has trouble regulating blood sugar, particularly seniors who are living with diabetes. Mangoes can have a high glycemic index, which means that they can cause rapid spikes in blood sugar levels. For seniors who are managing diabetes or even prediabetes, consuming too many mangoes could make it difficult to maintain proper blood sugar control. This can lead to complications like fatigue, increased thirst, or frequent urination. Over time, consistently high blood sugar can damage organs, nerves, and blood vessels, which is why it's important to keep an eye on sugar intake. If you love mangoes but have concerns about your blood sugar, don't worry. You don't have to completely give up this tropical fruit, but moderation is key. Consider having a smaller portion, or balance the mango with a protein or healthy fat to help prevent those blood sugar spikes. Alternatively, you can choose fruits that have a lower glycemic index, like berries, apples, or pears. These fruits provide the sweetness and nutrients without the same impact on blood sugar. As always, if you're managing diabetes or any other condition, it's a good idea to check with your doctor or nutritionist to make sure you're making the best fruit choices for your health. 5. Avocados. Let's now talk about avocados. Avocados have become incredibly popular in recent years due to their reputation as a superfood. They are packed with healthy fats, particularly monounsaturated fat, which is great for heart health. They are also full of vitamins, fiber, and antioxidants. It's no surprise that many people enjoy adding avocados to their salads, sandwiches, or even eating them straight with a pinch of salt. However, as healthy as avocados are, they can also be problematic for some seniors, especially those who are dealing with weight management or high cholesterol issues. While the fats in avocados are healthy, they are still fat and they're calorie-dense. For seniors who are trying to manage their weight or reduce their calorie intake, eating too many avocados can make it harder to maintain a healthy balance. Even though the fats are good for the heart, consuming them in large quantities can lead to excessive calorie intake, which may result in weight gain over time. For seniors with high cholesterol or those at risk of cardiovascular disease, too much fat, no matter how healthy, could also contribute to clogged arteries or other heart issues. If you enjoy avocados but are worried about their calorie content, it's not necessary to cut them out of your diet completely. You can still enjoy them in moderation. Instead of using a whole avocado on your sandwich, try using just half, or even a quarter, to keep the portion size in check. Another option is to swap out avocados for other heart-healthy fats like olive oil or nuts, which are lower in calories but still provide those beneficial fats. It's all about finding the right balance that works for your health needs. If you're unsure about how much avocado is appropriate for you, speaking with a healthcare provider or a nutritionist can help guide you in the right direction. 6. Dried fruit. Now, let's talk about dried fruit, specifically raisins and apricots. Dried fruits are often seen as a convenient and healthy snack option, especially when fresh fruit is not readily available. They're packed with nutrients and vitamins, and they can be a quick energy boost. However, there are some serious risks associated with dried fruits, particularly for seniors. While they may seem like a healthy alternative, dried fruits like raisins and apricots can be much more dangerous than you might think. The main concern with dried fruit is that it's incredibly concentrated. When the water is removed from the fruit, the sugars become more concentrated as well. This means that a small handful of dried fruit can contain a high amount of sugar, which can spike blood sugar levels. For seniors who have diabetes or are at risk of developing it, consuming dried fruit can cause rapid blood sugar increases, making it harder to manage the condition. Additionally, the sugar in dried fruit can contribute to weight gain and other health problems when eaten in excess. Another issue with dried fruit is that it often contains high levels of oxalates. Oxalates are naturally occurring compounds found in many foods, and while they're not a problem for most people, they can be troublesome for seniors who are prone to kidney stones or have compromised kidney function. High oxalate intake can interfere with calcium absorption and increase the risk of kidney stones, which can be incredibly painful and difficult to treat. If you love dried fruit, it's important to consume it in moderation. Stick to small portions and balance it out with other fresh fruits that are lower in sugar and easier on your kidneys. For example, fresh berries, apples, and citrus fruits are great alternatives that still provide the nutrients you need without the added sugar or oxalate concerns. As always, if you have concerns about your health or the impact of dried fruit on your body, it's a good idea to speak with your doctor or nutritionist to make sure it's safe for you to enjoy. 7. Apples. Lastly, let's talk about apples. Apples are often considered a healthy and refreshing snack for people of all ages. They're low in calories, high in fiber, and contain various vitamins that are great for the immune system. They've been a staple in many diets for years and are often recommended for their heart-healthy properties. However, apples can pose certain risks for seniors, particularly for those with digestive issues or a sensitivity to certain compounds in the fruit. The primary concern with apples is their high fiber content. While fiber is important for digestive health, too much of it can cause problems, especially for seniors with conditions like irritable bowel syndrome, IBS, diverticulitis, or other gastrointestinal disorders. Apples contain both soluble and insoluble fiber, which can be too harsh on the digestive system for some people. The insoluble fiber in apples, in particular, can lead to bloating, gas, and discomfort if consumed in large amounts, and seniors with sensitive digestive systems may find it difficult to break down this type of fiber efficiently. Another issue with apples is the presence of fructose, a type of sugar that can cause problems for people with fructose intolerance. This condition can lead to stomach cramps, bloating, and diarrhea after consuming apples or other high fructose foods. For seniors with a history of fructose intolerance or those experiencing digestive issues, apples may trigger these uncomfortable symptoms. Even though apples are generally considered healthy, they may not be the best option for everyone. If you enjoy apples but struggle with digestive problems, try peeling the skin off before eating them, as the skin contains most of the fiber. Alternatively, you can choose other fruits that are lower in fiber and fructose, such as bananas or berries. As always, it's important to listen to your body and consult your doctor if you have any concerns about how apples or any other fruits might affect your health. Thank you for watching. If you enjoyed this story, be sure to check out more of our videos. We have plenty of inspiring and powerful stories waiting for you. Don't forget to hit the like button, subscribe, and turn on notifications so you never miss an update. See you in the next video.